I want you to imagine for a second that you've spent weeks comparing Medicare Advantage plans. You've looked at the premiums, you've checked the drug costs, and most importantly, you've checked the provider directory to make sure your heart specialist and your primary doctor are both on the list. You sign up, the coverage starts, and you call to make an appointment. That's when the receptionist tells you they haven't taken that plan in 3 years. This isn't just a minor mistake. It is what we call a ghost directory, and in 2026, it has become one of the biggest traps in the entire healthcare system. If you are helping an aging parent navigate this right now, you need to know that the game just changed. As of May 2026, we have new federal protections under the Real Health Providers Act that give you a way out of these ghost networks. But if you don't know how to use these rules, you could end up stuck with out-of-network bills that run into the thousands. We're going to spend the next 20 minutes breaking down exactly why these directories are so messy and how you can use the new 2026 laws to fix a bad enrollment decision. The scale of this problem is honestly hard to believe. Recent audits have shown that in some plans, over half of the doctors listed in the directory either aren't at the location listed or don't actually take the insurance. It's a systemic failure. For years, insurance companies have used these directories as a marketing tool to make their networks look bigger and more impressive than they really are. They know that for a senior, keeping your doctor is often the #1 priority. By listing ghost providers, they trick families into signing up for a plan that doesn't actually provide the access it promises. This is especially bad when it comes to mental health and behavioral specialists. I've seen families search for months for a therapist who takes Medicare Advantage, calling every single name on a 50-page list, only to find that not a single one is actually accepting new patients. It's exhausting, and it's dangerous because it delays care when people need it most. But here's the good news. Since February of 2026, the law finally has some teeth. The new Real Health Providers Act mandates that Medicare Advantage plans have to verify their doctor lists every 90 days. If a doctor leaves the network, the plan has exactly 5 business days to pull them off the website. No more leaving retired doctors or doctors who moved across the country on the list for months at a time. And starting this year, if a plan fails these accuracy audits, they have to publicly display their accuracy score on the Medicare Plan Finder. It's like a health inspection grade for a restaurant, but for your insurance plan. But what do you do if you're already in a plan and you realize your doctor was a ghost? This is the part that most people miss. In 2026, there is a brand new Special Enrollment Period specifically for people who were misled by inaccurate directory information. In the past, if you signed up for a plan and found out your doctor wasn't in it, you were usually stuck until the next open enrollment period in October. Not anymore. Now, if you can show that you relied on a plan's directory or the Medicare Plan Finder and that information was wrong, you have a window to switch plans or even go back to original Medicare. This is a massive shift in power back to the consumer, but you have to act fast. You generally have about 3 months from the time you discover the error to trigger this special window. If you wait too long, the government assumes you've accepted the new plan and your window closes. I want to walk you through a family scenario to show you how this works on the ground. Let's look at the Smith family. Their mom, Sarah, needed a very specific surgeon for a hip procedure. They found a plan that listed this surgeon as a Tier 1 provider. They enrolled Sarah, but when they called to schedule the surgery, the office told them they had dropped that insurance 6 months ago. In 2025, Sarah would have been stuck paying out-of-network rates or waiting a year for surgery. In 2026, the Smiths called 1-800-MEDICARE. They reported that the directory was inaccurate, and they provided a screenshot of the plan's website showing the doctor was still listed. Because of the new laws, Medicare granted Sarah a special enrollment period. She was able to switch to a plan that actually had her surgeon in-network within 30 days. It saved the family over $15,000 in out-of-pocket costs. This is why I tell everyone, take screenshots. If you're looking at a directory during enrollment, save a copy of that page. It is your get-out-of-jail-free card if the information turns out to be a ghost. While we are talking about these directories, we have to mention the big drug news for May 2026. While you're checking your doctors, you also need to re-verify your medications. We are just weeks away from the July 1st rollout of the GLP-1 Bridge program. If you are on weight loss medications like Wegovy or Zepbound, and you've been paying full price, that is about to change. The government just announced that eligible seniors will be able to get these drugs for a flat $50 copay starting in July. But here is the catch related to our directory talk. Not every pharmacy is participating in this bridge program. Just like with doctors, you need to verify with your pharmacy now, in May, that they are set up to handle the Medicare GLP-1 bridge. Don't wait until July 1st to find out your local drugstore isn't part of the network for that $50 price. I also want to touch on the new Part D out-of-pocket cap. For 2026, that cap is $2,100. Once you spend that much on your prescriptions, you pay $0 for the rest of the year. This is a huge relief, but it only works if your drugs are on the formulary, which is basically the directory for medications. Just like ghost doctors, plans sometimes change their drug lists mid-year. If your parent's medication suddenly jumps in price, don't just pay it. Check to see if the plan dropped the drug or moved it to a higher tier. If they did, and they didn't give you proper notice, you might have grounds for an appeal or another special enrollment window. So, how do you protect yourself from these ghost networks as we move through 2026? It takes a little bit of legwork, but it is worth it. First, never trust an online directory alone. Even with the new 90-day verification laws, mistakes still happen. Always call the doctor's office directly. Don't just ask, do you take Medicare? Everyone takes Medicare. You have to ask, do you take this specific Medicare Advantage plan name and network? Second, check the Medicare Plan Finder for the new accuracy scores. Plans with low scores are being flagged by the government this year. If a plan has a history of ghost providers, it will show up in their rating. It's one of the most powerful tools we've ever had to hold these companies accountable. Third, if you're a caregiver for an aging parent, keep a log of who you talk to at the insurance company. If a representative tells you a doctor is in network, write down their name, the date, and the time. If it turns out they were wrong, that log is your evidence to get that special enrollment period approved. It feels like a lot of work, and frankly, it shouldn't be this hard for families to get basic health care. But the system is built on these complex layers, and until the ghost directory problem is fully solved by these new 2026 regulations, the best defense is being an informed advocate. You are the one who has to verify the reality behind the marketing. I genuinely feel for the families who are dealing with this right now. It is incredibly frustrating to feel like you've done everything right. You did the research, you picked the plan, you paid the premiums, and then the system fails you at the moment you need a doctor. But I want you to feel empowered. These new laws are a huge step in the right direction. For the first time, the insurance companies are facing real financial penalties for these ghost lists. They are being forced to be honest about who is actually in their network. Before I wrap up, I want to hear your ghost stories. Have you ever picked a plan for a specific doctor only to find out they weren't there? Did you try to use the new 2026 rules to switch plans? Let me know in the comments. Your experiences help everyone else in this community avoid the same traps. We are building a library of real-world knowledge here that is much more accurate than any insurance company directory. Navigating Medicare and Medicaid in 2026 is all about staying one step ahead of the paperwork. It's about knowing your rights before you need them. Take those screenshots, call the offices directly, and don't be afraid to demand a special enrollment window if you were misled. You've earned these benefits, and you shouldn't have to settle for a ghost network. Protect the paperwork, verify the doctor's status with a real human at their office, and always ask one better question before the next decision. I'm so glad you spent this time with me today. It's 20 minutes well spent to protect your family's health and your budget. I'll see you in the next guide.